From the Toronto Star, I'm Rudgy Mudler, and this matters. For people who have been suffering with long-haul symptoms of COVID-19, life is often measured in little victories. One recent one is the fact that their condition now has a name. Coined by Dr. Anthony Fauci in the US, people who are suffering from long-haul symptoms can call it by its official name, post-acute sequelae of SARS-CoV-2, or PASC. Considering many are looking for answers to their problems, recognition of their disease is an important first step toward recovery. But with many disparate symptoms and many different approaches in dealing with those suffering around the world, this is a problem that may be around long after the majority of us have been vaccinated. May Warren is a reporter with the health and science team covering COVID-19 at the Star. She's been speaking to long haulers throughout the pandemic. She joins us to talk about their struggles to find treatment. May, thank you so much for being with us once again.
Thank you for having me. Glad to be here.
So, May, while a lot of people are just looking ahead at vaccines, you've been talking to people who've been dealing with long-haul COVID. People who have been infected for a really long time. First off, I would want to talk a little bit about the symptoms some of these people are facing, and then just sort of if there's an idea or an estimate of how many people this might affect.
Yeah. So what I've heard from people who are still suffering with COVID-19 symptoms is that there's kind of a whole range of them, and they kind of sometimes come in waves. Like they'll be suffering with a kind of a grab bag of them, and then there'll be like another wave of new symptoms. And it's everything from fatigue to issues with like racing heart rate, to what people call brain fog, which is just like having a lot of trouble concentrating or focusing and forgetting things, and even things like gastrointestinal issues, just things like that. And, changing during the course of, months and months, but with some kind of sticking out more for some people than others. And it's so strange, right? Because I feel like for COVID, everyone is different, and that you kind of see that as well in the long haulers.
Last Sunday, for example, I was vacuuming and I was so out of breath. I had to pause, breathe, and then that exhausted me for the entire day.
When it gets bad, I get like this buzzing and ringing in my ears, and my short-term memory is really poor.
The symptoms that I have that remain are nausea and headaches and some fatigue mostly.
My post-COVID symptoms that I've been experiencing are loss of hair, loss of smell, of course, memory fog, memory loss, joint pains in different places.
But I guess if there were kind of like two major themes that I kind of heard, I think it would be people struggling with brain fog, which is really scary because these are young people feeling like they, are leaving their socks rolled up in the fridge, finding that, or not being able to remember the names of friends or things like that. And then another group of people, sometimes overlapping, but some people dealing with like heart and respiratory issues. So breathing issues and also racing heart rate, as I mentioned.
I also know it's very, very difficult to sort of figure out how many people this affects, but I believe the World Health Organization said there's a significant number of people. And in your story, was an estimate of possibly as high as 10%?
Yeah, there are different studies. So yeah, around 10% is one estimate. I've seen one study actually that said as high as 30%, but it's really hard to get a handle on it, especially here in Ontario, because no one is counting these people. And, when you do get COVID, you're usually followed by a public health unit for 2 weeks. But after those 2 weeks, if you don't die, you're marked as recovered, right? So you're just kind of then lost. And it's really hard to know. There are, Facebook groups out there for people in Canada struggling with COVID long haul, and there are thousands of people in some of those groups. But yeah, I'd say maybe 10% would be the low estimate. And it's been recognized, as you mentioned, by, officials at the World Health Organization and also by Dr. Anthony Fauci in the US as a really significant problem impacting a lot of people.
I want to get into how some of these people might be getting lost in the shuffle, but you talked to a number of specific people. Can you just paint a picture about their lives right now and, what they're dealing with and their day-to-day?
Yeah, so I talked to a couple of women in this article. One of them, her name is Tracy Thompson. She's in her 50s, and she was very active before getting COVID. She was a chef, so she was, working and really active person, but she's been sick since March and just deals with really crushing crushing fatigue. So every day it's kind of just getting up and seeing if she has enough energy to make herself, some cereal, go on a little walk if it's a really good day, do those daily tasks. Another woman I spoke to, her name is Sonya Mali. It's 35 years old and was very healthy as well before this. It's kind of the same, just having the energy to take a little walk and to kind of do those basic household things is really taking a lot out of her still. And I asked, do you kind of get bored just because you're at home all the time? And both of them were kind of like, it just takes so much energy to do basic things like getting up and getting dressed and making food that actually your days are kind of consumed with that. But basically, neither of them are anything like what they were before. They're both coming up right now in mid-March on the 1-year anniversary of being sick. And it's just really scary for them to not know, when and if they're ever going to get better. And everyone I spoke to understands that this is a new disease and that doctors don't have all the answers, but they just want to know that, people are listening and understand, and they're really looking for some kind of care that would recognize that long haul COVID is a real thing and that would kind of look at their situation like holistically, as studying it as different symptoms coming from COVID and not just as, random things that they're being sent from specialist to specialist for.
To start off with that, it is starting to be officially recognized, right? What's this called now?
Yeah, so Dr. Anthony Fauci in the US recently gave it an official name, which is post-acute sequelae of SARS-CoV-2. So the acronym is PASC, and that was in late February. So basically that means kind of just like symptoms of COVID that continue after the really acute phase. So he did that, and they're also launching a national study in the US and putting some money towards it. As you mentioned, World Health Organization officials have recognized that it's a serious issue affecting a lot of people. And yeah, in other countries, we're starting to see some movement on it. In the United Kingdom, the National Health Services there in England has provided £10 million to fund like a network of clinics that can serve people with long haul COVID in different parts of the country. So not just in the big cities. And it's kind of a specialist clinic place where people can go and see lots of different healthcare professionals, and doctors can kind of see the whole picture, and they're informed about what long haul COVID is and the latest research and all that kind of stuff. So they've really kind of taken a leading role, I think, there.
You jumped ahead to my next question. I was going to be asking, what are the efforts around the world? So the UK has a sort of clinic. It's spread around. It's more of a holistic approach, as you mentioned, with a bunch of specialists. Is there stuff happening in the US as well?
Yeah, there's stuff happening in the US. I think it's less coordinated, but definitely there is a recognition there from top officials, and there are different post-COVID clinics. I think there's one big one in New York City, which, as we know, was hit really hard in the first wave. So there are a lot of long haulers there. And then you are seeing them popping up in different places in the US at some of the different major hospitals. I spoke to a doctor at the Massachusetts General Hospital in Boston, and they have a long haul clinic there actually that she works at that deals with people who are still struggling with symptoms and focuses on two major areas, one being the brain fog and one being like cardiac respiratory issues.
What's happening in Canada? Anything?
So what's happening in Canada is there are like a few post-COVID clinics at different hospitals. I think there's one in London, Ontario, and there's also a rehab at University Health Network in downtown Toronto. But what long haulers told me was that it's just really not coordinated, and it's really not enough to meet the huge demand of people who are still struggling with this. And one of the issues is that a lot of the people who are dealing with it now weren't able to get tested, because if you'll remember back in March, April of last year, there was the shortage of tests in Ontario, and people were told not to come in and get tested if they were, just at home just to ride it out. So people didn't go, but then that kind of leaves them without a piece of paper to prove that they have it. And I noticed in the UK, they will take people to the special long haul clinics if they have a test or they can like reasonably be believed to have had COVID. So that kind of opens it up more to some of these people that are falling through the gaps. And I know even looking through the social media groups for survivors, there's a huge demand for care. And there's a lot of people who just don't have anything. They have their family doctors who are doing their best, but they don't have anything like what's available in the UK. And they really need help because they're really not who they were before this disease.
We'll be right back. I think you've mentioned this already, but I want to be very, very clear about some of these gaps. So first off, basically, if you're tracking and, you sort of get past 2 weeks, you're not really counted. The next one then is that in case you had it, but it was before the PCR testing, so you can't prove you had it. And then there's even potentially, you mentioned in the piece that potentially antibodies could be gone as well. So, what kind of a no man's land are some of these people in where they kind of have to prove that they even had this to try and get support that there isn't really a lot of? Is that sort of what's happening?
Yeah, definitely. That's a good way to explain it. So, for example, Tracy Thompson, who's one of the women that I spoke to in this story, she started getting sick right in mid-March of last year, but she was told not to come and get a PCR test because there weren't enough at that time. And, they were only recommending them for people who had underlying conditions or travel histories. It was shifting at the time, but they weren't widely available. So she followed that instruction. She didn't get the test. Then she tried to do an antibody test later, but by that time, the antibodies had faded, and that can happen sometimes. Scientists aren't sure how long that antibody protection lasts for people who have had COVID, so it can fade. And then you're kind of left without a piece of paper to prove that you had it, but you had all these symptoms that were consistent with it. And, you could give a kind of a clinical diagnosis. This person most likely had COVID and open up those clinics to them. So I think that's really where a lot of people are at, especially people who got sick in the first wave. And, sometimes they're even gaslit and having to explain and try and get people to believe them that they are still sick and that this is what it is. Yeah, so that's why I think maybe the NHS model in England is something that people would want, is because it opens it up to people who have a reasonable chance of having had it rather than just limiting it to people who have positive tests.
The thing that's on everybody's mind right now are vaccines. Is there any science behind the vaccines helping these people at all?
There's been some anecdotal reports of the vaccines helping long haulers, but they're, very scattered. It's nothing robust. I haven't seen any, peer-reviewed studies about that yet. So I think everyone's just kind of waiting to see if any more research comes out about that. Certainly the long haulers that I spoke to said they were planning to get the vaccine just because, they aren't sure if they might get it again, if the antibodies have faded, and they're really afraid of getting it again. And they definitely have faith that the vaccine is a good thing to do for themselves and others. But I guess we'll have to wait and see if there's, any emerging scientific evidence on how exactly the vaccines affect the long haulers. And something else too, I would add that a lot of the people I spoke to are looking for is also just recognition from health officials in Ontario and in Canada. We've heard recognition from World Health Organization and also from Dr. Fauci in the US, but we haven't heard our own officials at the provincial and at the federal level talking about long haulers or saying, this is a huge problem or things like that. I've heard Dr. Williams mention it with relation to Ontario Hockey League players getting back on the ice. He was just kind of almost like an offhanded comment recently speaking about how, have to be careful bringing back these kinds of players because even young people can get long haul COVID and it can be bad. But I haven't heard him say this is a huge issue and we need to address this and we need to devote funding towards it and we need to have a coordinated approach. And I think that's what people are looking for. And they're afraid with vaccines happening that people might just kind of forget and move on and want to get the economy restarted and get to those roaring 20s and that they'll be kind of left behind.
Well, obviously, we have to take care of the hockey players. I'm kidding. Now, it sounds like these people are lost. Where are they finding support?
So a lot of them are finding support online in support groups with other survivors. So there's a big Facebook group in Canada, and there's also a Slack group called Body Politic, which I think is international, where they can just kind of go online and share information with each other, but also just little victories and challenges and things like that. So there definitely seems to be kind of an emerging patient movement of these people, and they're kind of organizing themselves and advocating for themselves, which is really interesting and pushing to be recognized and kind of fighting for help and organizing that way and getting support that way.
Let's talk about some of those little victories. I think one of the things that you mentioned in the story is people saying yay, I brushed my teeth today because things are so hard. Is that the type of stuff that's on those forums?
Yeah. Apparently on the Slack channel, the Body Politics Slack channel, there's a little victories kind of channel where people just celebrate oh yeah, I brushed my teeth today, or I went for a walk, or I made myself a meal, just those tiny things that most people would really take for granted. But, people are still really struggling with months, even up to now a year later. So they're getting support from other people all around the world through those forums, but they definitely really need help closer to home. And that was one thing that really came through clearly is they really want to see more help from our own public health officials here in Ontario and in Canada.
There's no link between these people at this point, right? There's no actual studies to say there's some commonality between the long haulers as far as we know.
I think they are definitely studying it. There's been a few studies kind of looking at age, and there's been a few, I think, early studies looking at gender as well. But that's definitely an area that is still being studied for sure.
One of the things I wanted to mention is about that brain fog and the doctor who's been trying to deal with what she called neuropsychiatric COVID. Did she talk about what type of treatments they're using for that at all?
Yeah, so she said that they were looking at like even cognitive behavioral therapy, maybe some medications, and also even physical therapy and things like that. And she also said that people who were dealing with that were dealing with a lot of depression and anxiety as well. So sometimes they were offering medication for that. And also even that sleep was really tied up in that. And a lot of people were dealing with insomnia, which was kind of interesting. So offering support for that as well.
Well, man, this is one of those things. I mean, like I said, a lot of us are trying to see the light at the end of the tunnel. And unfortunately, we're talking about people who seem to be quite honestly stuck in the tunnel. This was a fantastic story. I really appreciate your time. Is there anything that you think that I didn't ask that you think our listeners need to know about this?
No, I would just maybe add that, a lot of times when we hear numbers about recovered people or we look at the death rates for COVID, people sometimes use that as an excuse to say like, oh, well, I'm younger and I'm healthy. So, they assume they wouldn't have any problems. But long COVID is affecting people who are younger and who didn't have any other issues before and who were very healthy and active. So it's just scary because you don't know, who is going to barely have any symptoms and who is still going to be struggling with it months later. And it's definitely something that people should be thinking about. And it's part of why COVID is such a huge issue and threat, is not only because of the people that tragically die, but also because of people who are really transformed by it for months, even up to a year. And it's something that people should keep in mind when they think of the disease. And also the fact that we don't know exactly how many people are impacted. But even if we use the estimate of 10%, that's a lot of people, right? So this is going to continue to be a huge public health issue, even as we go forward with the rollout of the vaccines, if we can get new cases under control.
Such a weird, nasty disease. May, I really, really want to thank you for your time today and for sharing the story with us.
Thank you so much for having me.
May Warren is a reporter with the Health and Science team covering COVID-19 at The Star. That's it for today. Thanks so much for joining us. This Matters is hosted and produced by me, Rajin Budler, Adrian Chung, and Saba Etisaz. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.